and we would also like to thank our sponsors, Menarini and Westmont Pharmaceuticals. Okay, I have a question before I also share my inputs. Um, the treatment guidelines that you shared with us, what year was that in? Is that from an allergy or a dermatology guideline?
It was published by the Journal of Allergy and Clinical Immunology, which was a result of the joint task force for practice parameters by the American College of Allergy, Asthma, and Immunology and the American Academy of Allergy and Immunology. So they formed a joint task force to create the treatment guidelines for urticaria and angioedema and published this update in 2014.
Okay.
So I can send you a link for...
Yes, if you can share the link, we can send to all our participants. There is a new antihistamine that is here in the market. I don't know if you have it in the US also, the Bilaxten or Bilastine. So it's a new antihistamine also of non-sedating, and it is indicated also for urticaria. Do you have any experience with this?
No. Have you used it?
Yes, I have used it, and it works like any other second generation antihistamine, and it can be used for urticaria and other allergic conditions too. So I have a comment regarding the need for a stool examination in urticaria. You mentioned history of travel as a caveat for ordering the stool exam, but here in the Philippines, we also noticed that intestinal parasitism is rampant, especially among children, and so sometimes we do a stool exam just to rule out intestinal parasitism in a patient.
Oh, I guess so that would be it's important perspective. So thank you, Dr. Genuino. That's important perspective because in the U.S., there's a very, very low incidence of intestinal parasitism. So typically the history would be the only way to deduce that the patient has traveled to areas that they may be infested.
Another thing is you mentioned about cyclosporine. Personally, I have not used it for urticaria, and I have used it in T-cell related immune disorders like eczemas, atopic eczema, or other eczemas. But for urticaria, I have not tried it, and I'm usually successful with just using the non-sedating antihistamines together with montelukast, and I've also rarely used oral steroids. As you have mentioned, it's not part of the guidelines. Although in some cases where there's a very acute trigger, like for example, the patient comes to you within 24 hours of ingestion of a certain food and there's an impending risk of angioedema, or the patient already has a history of angioedema, severe or anaphylaxis to that particular food, sometimes do you feel that there is a role for oral steroids in such a case? Like the patient comes to you with a history of ingestion in the past few hours?
That's a good question. I've used oral steroids in cases of anaphylaxis if there is history of asthma or if the patient is acutely wheezing. So there's acute respiratory involvement, but not as a part of the treatment for anaphylaxis or the anaphylactic episode. Is that your question?
Yes.
Okay.
So it's not an indication. Another thing you did not elaborate on it, but being a tropical country, solar urticaria could be an issue here. So I have some patients who are foreigners, and when they come to the Philippines and like go to Boracay, they experience solar urticaria, which they did not experience back home. So that's one thing that should be considered in a patient presenting with urticaria in a tropical country like ours. So we are open for questions. Okay, there is a question here by Dr. Santiago. How does the H2 blocker work?
It's just additional because H1 receptors don't block all of the histamine receptors. I think Allegra only blocks 75%, cetirizine only blocks 50%, Claritin only blocks 72% of the histamine receptors. So addition of another H1 blocker, another H2 blocker can saturate all the empty histamine receptors and can be an add-on or adjunct to therapy.
Okay, we have a question from Dr. Dualan. Do we have data on the prevalence of chronic urticaria in the Philippines? So I think this data would be available with the Philippine Dermatological Society.
Dr. Dualan, thank you for your question. I actually, in making this talk, I did speak to our colleagues in the Philippine Society of Allergy, Asthma, and Immunology. I met with Dr. Recto and Dr. Casala at the American College of Allergy and Asthma meeting in San Antonio. So far, the only prevalent studies that have been published are for allergic rhinitis and asthma. Wala pa pong data on urticaria.
In the Philippine Dermatological Society, we have a health information system, but unfortunately, I do not have the stats. But I can send them to you, to our participants, the prevalence of chronic urticaria. But I would suspect it's also the same as what you mentioned in the U.S. Because it is quite common to see chronic spontaneous urticaria. Even if you do workups, it turns out negative. So I think we also have a high incidence of chronic spontaneous urticaria. So any more questions? Just type in if you have any more questions. I think your lecture was very straightforward and very understandable. I think they understood everything and they have no more questions. So thank you very much, Dr. Tamesis, for that engaging discussion, and we were very enlightened on your lecture. So after this session, an email containing a survey link will be sent to all the participants. Please answer the survey so we can assess our webinar and address more of your preferences and give you materials for this session. After answering the survey, your certificates will be sent to you. Special thanks to our sponsors, Menarini and Westmont Pharmaceuticals. In behalf of the UPCM Class 1990 and the UP Medical Alumni Society, we also thank our collaborator units, the UP Manila Information Management Service, National Telehealth Center, UP College of Medicine Postgraduate Institute of Medicine, Medical Informatics Unit, DOST-ASTI, and Ms. Charisse Orhalo, our host. May we invite everyone to join our next webinar on health informatics, and this would be now the year to be handled by the UPCM Class 1991. So their first speaker will be Dr. Alvin Marcelo on February 3, 12 noon to 1 p.m. So starting February 3, UPCM Class 91, we will be conducting the webinars. And they will be conducting their webinars every last Wednesday of the month from 12 to 1 Manila time. So please take note that there will be 2 webinars in February. The first one will be February 3. That's the first Wednesday, Dr. Alvin Marcelo. And then there will be another webinar on February 24. That's the last Wednesday of February. So subsequently, all webinars for this year will be held every last Wednesday of the month, starting from February 24 onwards. So thank you very much to all our participants, to our speakers, and to our sponsors. Signing off from UP Manila's video conferencing room. Goodbye.